Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here for Gold Midwifery and Gold Learning. And I'm very excited today. We have a guest here and it's Parijat Deshpande. Welcome.
Hi, thanks for having me.
And it's wonderful to have you here. You will be speaking at our upcoming Gold Midwifery Conference of 2022, and you're the author of Pregnancy Brain. I have that here. And this is actually one of the copies that we're going to raffle off during the conference to our viewers that attend the conference. And I'm very excited about it. So tell us a little bit about yourself before we get started and talking about the presentation and your work here at Gold. Tell us a little bit about yourself, your background, and your work.
Sure. So, hi everyone, I'm Parijat. I am based in the United States, in California specifically, and I am the mother of two medical miracles, which is
Mm,
actually the inspiration for the work that I do. I work with women specifically who have experienced late term loss or preterm delivery, and I take a trauma informed neurobiological integrative approach to help them stay pregnant and to prevent pregnancy complications in their next pregnancy so that they can bring home their babies. And it really was completely inspired by my personal experience. I very much acknowledge that had I not been through what I'd gone through with a whole host of difficulties to get pregnant and stay pregnant and bring these babies home, I wouldn't have known to do this work. And it was truly from having been on the other side as the patient and recognizing the gaps that are in the medical care, the gaps that are in all the access to information, education on how much power we as women and birthing people have in order to influence our pregnancy outcomes, that really, really just drove me to switch my careers and kind of completely start over and come into this world to work with women through their high risk pregnancies.
and it's wonderful because you know that side, you have experienced it, right? So you know what women, birthing people, families need who are, experiencing birth trauma or, loss or anything like that that could, have very much influence how the next pregnancy or birth will go and so you understand what really is required. So how does your work with these families look like? What do you do exactly?
Yeah, so I work one on one with my private clients and I work with them long term. So from conception to homecoming, because
Mm,
one of the things that was really important to me that I didn't receive as a patient that was very jarring was the cold handoff between fertility clinic to OB to MFM to NICU to pediatrician.
mm,
Every place it was, as soon as we became very familiar, we got very familiar with our whole medical team the whole way through because we needed
yeah.
so much support. But as soon as we were very comfortable, something happened, and we would
Hmm.
be then sent off to a brand new person, brand new clinic, brand new team who we had no rapport with, we had no relationship with. And so that was very important to me, is that if that were to happen to my clients, they knew that they would have one person as the common thread all the way through. And
Hmm.
the work that I do is entirely based on body based work, meaning we do nervous system regulation, we do sensory motor work, sensory work, really regulating the body out of that traumatic state into a safe state, and then using that safe state to promote essentially neuroendoimmune balance, which is what's required for a healthy pregnancy and to protect ourselves from future pregnancy complications and helping us to stay pregnant. And so all of my work has been virtual from day one,
Hmm.
even before the pandemic. So that switch wasn't too difficult for me here. And it involves partners if there are partners involved. And really, it's just very robust whole health support from conception all the way through homecoming.
And that's absolutely wonderful because you are so right. There is no kind of, the handoff is kind of, it's sterile, right? And you maybe you found a very good midwife healthcare provider, that you're comfortable with, and then something happens, and then there is the handoff to the specialist, to the or something happened during birth or prenatal,
Yeah.
there's preterm labor, and all of a sudden you end up with a little one in the NICU, and there is no handoff, right? It's just like boom,
Yeah.
and then you're in that situation, and what do you do? And it is so difficult to facilitate that it's going in a warm way, in a kind of, and not the sterile isolated way that can be very traumatic. So you're
Exactly.
absolutely right, your own experience really helped you there to create that environment, to know exactly what the families need. I became a midwife too after a not so happy birth, knowing, you know, what the woman's body can do, and how, what we're capable of, and just how much it means to have somebody caring and loving it by your side, who guides you, and who is your care provider. So that, you know, made me become a midwife. And many of my midwife colleagues and friends, that's, you know, they, midwifery is a calling to them, it's not just a job, right?
Yes.
and and they work so hard to have that, you know, a loving, caring environment for not only the woman, the birthing person, but also the entire family. And then something unforeseen happens, and then boom, here we go, right? And this transition is really, really difficult. So I'm happy to hear that there's professionals out there like you who can kind of have the loving guidance there, and help families through this very difficult experience, because we as midwives don't over have any much not very much control of what happens
Yeah.
if we need to hand over care to, you know, a neonatologist, or you know, a perinatologist. Kind of often, at least here in the United States, then cares handed over, and we can, yeah, of course we'll stay in touch with the family, but there's only
Yeah.
so much we can do, because we're no longer the care provider, we're no longer privy to the you know, documents or information from the other healthcare providers that have now taken over medical care. And you know, we're also very limited then. So it's wonderful to know that there's people like you out there who really can be there for these families.
Yeah. Thank you.
Yeah. Um, I would like to talk now about the presentation that you have here, and it's titled Birth Trauma, a Somatic Approach to Prevention, which I love. I think we need this presentation. There's so much going on that can be prevented. And in your abstract, you mentioned that you're calling it that, or you're saying in your abstract that birth trauma is a preventable complication. Now, let me ask you this though. What about the complications that you can't prevent, like the scenarios I mentioned before? Let's say even everything during birth is going well, and all of a sudden the baby's heart tones go down, and off we go to a C-section. That in itself can be very, very traumatic, even if the care before was kind and loving and such. So how do we handle that? That there is this trauma can be prevented, or can it even be prevented?
Yes, yes, it can. And we're going to go into this in the presentation, which I'm so excited about, is this very core concept that trauma is not the event. It is
Mm,
not the C section. It is not the heart decelerations. It is not the pregnancy complications. It is not the NICU. It is what happens in our bodies inside of those contexts. And
mm,
so we actually have a really fantastic setup, especially with. I love that you said, you know, midwives are called to this work, because we have a fantastic setup with such loving providers who are there because they really want to be,
mhm,
can be that safe person, and we can actually help train these providers such as yourselves to be able to help the birthing person be in a body that is protected from experiencing the C-section, the NICU, the, you know, interventions, whatever might be happening, protect them from being encoded as trauma, is what I like to
mhm,
call it. And what that requires is first really stripping away this pop culture idea that trauma is the event that happens to us.
mhm.
And it's so important to remember that, because that is also one of those things that helps us to minimize our experiences. And we say, well, you know, baby was born full term, baby was healthy, I'm healthy, I must not be traumatized. There's no way,
Right.
on paper
Mhm.
this looked great. And that's not at all the case. We know of so many, I'm sure you can think of so
Yep.
many
Mhm.
instances where on paper it was the perfect birth,
Perfect birth. Yep. Mhm.
and the birthing person walked away with the experience encoded as trauma, because it is not about the event. It is about
Yeah.
what happened in their body at the time of the event. And could they return back to safety after? If they couldn't, that's when we start talking about what trauma actually is. And that's why I'm so certain, and I feel so strongly that when we have enough of the players on the team
Mhm.
with this knowledge, we can all together support the birthing person in order to actually prevent birth trauma, really, regardless of what these experiences are like.
Absolutely. That sounds fantastic. Sign me up. I want to be part of this for sure, And you're so right when you mention it's not only the births that have a lot of medical interventions or things happening, or the emergency C-section, or the preterm labor and birth. It is also the births that look good on paper, as you mentioned, healthy mommy, healthy baby. And on paper, everything looks perfect. And the woman birthing person comes out of this thinking, there must be something wrong with me. Why do
That's
I
right.
feel like this? Why do I feel shaken, or why do I play the birth over and over in my head? And
That's
uh,
right.
but my baby is healthy, and everybody tells me, what's wrong with you? You have a healthy baby. You have
Exactly.
it went well. Get over it, right? And
Yeah,
we have to acknowledge that as well. That's not only the really dramatic situations that can cause trauma, but also the ones that look good on paper, but there's other things going on.
that's right.
Yeah. Well, Parijat, thank you so much for sitting down here with me and chatting. And I can't wait for your presentation. Your presentation will be live here with us on February 15th. Of course, it will also be recorded for anybody who can't be coming to the live. And also now you work with parents. You also work with care professionals. Where can we find you? Do you have a website? What can you tell us here where we can get hold of you as well?
Yes, the best way is through my website, which is my full name.com, parijatdeshpande.com. And
Mhm.
from there, you can see links to my one on one services and how I can work with you in a professional capacity, as well as a link to my book, Pregnancy Brain. And if you wanted to come follow along with where I am, I usually hang out on Instagram, which is linked to my website as well. But you can search for me at healthy.highriskpregnancy on Instagram too.
Wonderful. Well, thank you very much for sharing this, and thank you for talking with me here. And I'm looking forward to seeing you at the conference.
Likewise, thank you.
And for our viewers now, a little bit more information. If you are interested in this presentation and you want to learn more, and you want to learn also about all the other presentations of the conference, we would like to invite you to visit goldmidwifery.com. I hope to see you all at the conference. Bye bye, everyone.